everyone. Topic 6.1 is resolving conflict. I'm not going to go through the learning outcomes as you can access those on Moodle. So conflict is a natural part of human relationships. Dramatic situations that require a calm response are common, and that's why we're talking about this. Anyone can be angry, that's easy, but to be angry with the right person, to the right degree, at the right time, for the right purpose, and in the right way is not easy. It takes skill and self-control and empathy to listen and respond creatively when greeted with hostility. But what's conflict? It's usually a tension arising from incompatible goals where the actions of one frustrate the other. It's inevitable in any relationship, but typically a warning that something needs attention. Two components of conflict. The content problem issue is the concrete part of the problem, and the process issue is the emotion behind it. Client perception doesn't matter if you don't think the situation makes sense or not. Conflict almost always equals discomfort. Someone's reaction to conflict is usually based on previous experience with conflict, importance of the issue, and possible consequences. Causes of conflict is lack of or poor communication, differences in values, personality clashes, stress, cultural difference. However, once conflict is identified, it is your responsibility to take action and work to resolve it. You need to gain an understanding of your response to conflict when conflict happens. Is it a busy shift? Are you working short-staffed? If this incident had happened maybe the next shift, would you be responding the same way? So you need to be aware of that. Understand the context of the situation. Be conscious of what you say and how you say it. Your client may not remember exactly what you said, but they will definitely remember how you made them feel. So avoid creating that anger. And think about what kind of feelings you would have experienced if you were dealing with a similar conflict. There are 5 conflict management styles. So avoidance is a lose-lose. You just don't deal with it at all. That situation will come back. At some point, you'll have to address it. But nobody wins if you avoid the issue. Accommodation. Give in to maintain peace. Doesn't deal with the issue. That issue will resurface later. However, it's appropriate when the issue is more important to the other person. Competition. Winner takes all. It's a dominant. It's aggressive. Dictator. Effective for decisions that need to be made quickly, but when used long-term, increases problems and people's stress. Collaboration. Working together. Cooperative. Identify concerns together. Confront the real issues. Clarify assumptions. You're working together to find a solution that satisfies both of you. This is the ideal situation. Compromise requires negotiation, trade-offs, swappings. You win some, you lose some, kind of thing for both of you. And I apologize for the spelling error on this slide. So what factors affect responses to conflict? Be very careful of stereotyping. Females traditionally want to smooth things over, so they want avoidance and accommodation. Males are a little bit more aggressive, collaboration and competitive. Cultural issues affect how people respond to conflict. So personal style, previous experiences, how their culture deals with conflict, and their expected role. Professional ethics, you have guidelines on how you deal with conflict. And role socialization. Remember, the most common feelings with conflict are anger, embarrassment, and anxiety. 2 different types of conflict. Interpersonal is conflict within yourself, which is very much can be an ethical dilemma. Do I do the right thing? Is this the right thing or not? Interpersonal is between 2 or more people. There's a difference between being assertive and aggressive. So assertiveness is being able to advocate for yourself or others in a constructive way. You set goals. You act on these goals in a clear and consistent manner. And you take responsibility for the consequences of these actions. Now, this is a learned behavior. So the assertive person is able to say no, to ask for what they want, to appropriately express positive and negative feelings, and to initiate, continue, and terminate the interaction. They use statements like I statements. They take ownership, state how the problem affects them, not how they feel about the situation. Direct, honest statements. Needs to be learned and can very much be practiced. Use normal speed and tone of voice instead of the aggressive statements where you're assigning blame, dominating, and suppressing others. Now we have dysfunctional conflict, which is non-productive conflict. You get nothing done. Emotions distort the issue. The listener responds defensively. Nobody wins. It's a lose-lose situation. Conflicts obscured by hidden messages, denied feelings, feelings projected onto others. We all have our triggers or hot buttons that, once pushed, just sends us off. Do you know yours? It's important to know yours. So we try to focus on the current issue. Let go of the history. What's in the past stays in the past. Find current available options. Don't try to resolve the problem immediately. Work together. Find the best solution and then evaluate how well it worked or not. Not all problems need to be worked right at that time. So how do we resolve conflict issues? Identify the issue. Very important. Know your own responses that we already talked about. Separate the problem from the people. What's the problem? Not the behavior. Accept the person, not the behavior. Stay focused and on the underlying issues causing the behavior. Identify possible options. Use standards if appropriate. Prevent conflict. Use that professional, calm demeanor, low tone of voice. Same thing you're doing with patient in crisis. Active listening skills, undivided attention. Keep them focused on you. Appreciate the client. Your primary goal is to diffuse aggressive behavior and prevent conflict. Assess for conflict. So acknowledge that there's a presence of conflict. Acknowledge it's in the air. It can be in your face and can be covert. You kind of feel it, but you don't see it. Assess those verbal and nonverbal messages. What are they telling you? See beneath the exhibited feelings. So kind of dig deep. Why is this client acting the way they are? Is there something else behind it? Got to do a little sleuthing to find it. Strategies to resolve the conflict. Prepare for the encounter if you have time. You may not have time. Organize information in your mind, again, if you have time. Manage your own anxiety and feelings. Time the encounter. Is this a good time for both yourself and the client? Perspective. Is this actually a conflict you want to have? Is it worth it? Use therapeutic communication skills, those active listening skills. Use clear, congruent communication. Remember, if your verbal and nonverbal messages are not congruent, you will not be believed. Deal with one issue at a time. Mutually generate options. Give choices, break down barriers, request behavior change. Understand cultural implications. Evaluate your conflict resolution. Depends on conflict, how long it may take to resolve and evaluate. Some conflicts can be really easy to wrap up. Others may take a little bit longer. Identify clients' interpersonal conflict. Maybe it's not an interpersonal conflict. Maybe it's all about what's inside the client that's causing them. So help him to actually put into words what he's feeling. Talk about it. Tension reducing actions. Use active listening. Use humor if appropriate. Diffuse interpersonal conflict may be out of your control. You may need to get counseling for the client to help. And evaluate. How successful was it? Not always a linear process. Sometimes steps have to be repeated. I've often used the CARE mnemonic when I've dealt with demanding, difficult clients. So I clarify the behavior, what actually is the issue, articulate why it's a problem, request a behavior change, and encourage a change. I've used this quite a bit in recovery room when I'm dealing with children as they wake up, and it tends to work quite well. Encounters with angry clients. Anger manifests in a variety of ways. They can refuse to comply with treatments, hostile behavior, withdraw from you. So ask yourself, what is he gaining by acting this way? Maybe he's used these behaviors in the past and it's worked for him to get his own way. But it's important for you not to take the person's frustration or personally. By using non-threatening body language, you can actually diffuse it. But if you feel threatened, plan an exit and get out. So strategies for dealing with an angry client. Call them by name, active listening skills, neutral body language, low, calm voice, quiet environment. I find out my voice right now, I'm getting lower and calmer. Give permission to feel angry. Avoid arguing. Get help immediately or leave if you're in danger. Your safety is paramount. Keep your cool. Take a deep breath. Take a deep breath and count to 10. If you respond and lose control, you actually lose, as now you are being controlled. Lower the tone and speak slowly as to assert the message has not affected you, and establish a plan. Interpersonal conflict can diffuse and can escalate to interpersonal. So the conflict inside the person, he can draw it out and affect people around him. Misunderstandings can quickly escalate conflict. So set limits. Talking can often reduce aggressive behavior. In summary, identifying the reasons for the conflict and attempting to resolve the underlying causes for problem behavior constitute the most effective approach. To use this strategy, you must behave in an assertive manner rather than acting aggressively or passively. You have to take control to diffuse the situation. Anyways, that's it for topic 6.1. We're on to topic 6.2.